Welcome to NCLEX Map. Thank you for joining us at NCLEX Map, your trusted source for high-level NCLEX-RN preparation. This presentation contains 15 challenging, evidence-based questions aligned with the 2023 NCLEX test plan. Designed by nurse educators and clinical experts, these questions will sharpen your clinical judgment and help you prioritize patient safety. Let's dive in and prepare for NCLEX success. A client with chronic kidney disease has a serum potassium of 6.5 NCLEX-style. Which action should the nurse take first? The correct answer is to place the client on a cardiac monitor. This is crucial to assess for life-threatening arrhythmias associated with hyperkalemia. Immediate monitoring can prevent potential cardiac complications. A client with heart failure is receiving furosemide. Which finding requires immediate intervention? The correct answer is a potassium level of 2.9 MEq/L. Hypokalemia can cause serious cardiac arrhythmias. This critically low level requires immediate correction to prevent complications. A nurse is caring for a client with pneumonia experiencing increasing shortness of breath. The priority action is to apply oxygen via nasal cannula. This addresses the client's immediate need for adequate oxygenation, which is crucial for managing increasing dyspnea effectively. A client with type 2 diabetes mellitus has a blood glucose level of 600 mg/dL. Which symptom suggests hyperosmolar hyperglycemic state, HHS? The correct answer is altered mental status. This is a hallmark of HHS due to severe hyperglycemia and dehydration without significant ketoacidosis. A client with cirrhosis has ascites and is scheduled for a paracentesis. Which finding requires immediate intervention? The correct answer is blood pressure, 88/54 mmHg. Hypotension before a paracentesis could indicate hemodynamic instability, which must be addressed to prevent complications during the procedure. A nurse is caring for a client with a chest tube connected to suction. Which observation requires immediate intervention? The correct answer is constant bubbling in the water seal chamber. This indicates an air leak, which may compromise lung re-expansion and requires investigation. A client with a history of hypertension experiences a sudden severe headache and blurred vision. The priority nursing action is to obtain a blood pressure reading. This could indicate a hypertensive crisis, and obtaining BP is essential for immediate evaluation and intervention. A post-operative client reports sudden chest pain and shortness of breath. The first action should be to elevate the head of the bed. This promotes oxygenation and is the first step in managing potential pulmonary embolism symptoms. A nurse is reviewing lab results for a client with pancreatitis. Which lab value requires immediate attention? The correct answer is calcium 7.0 mg/dL. Hypocalcemia is a serious complication of pancreatitis and may lead to tetany and cardiac issues. A client with COPD is receiving oxygen at 4 L-min via nasal cannula. The nurse observes drowsiness and confusion. The appropriate action is to lower oxygen flow to 2 L-min. High oxygen levels can suppress respiratory drive in COPD clients. Lowering the flow rate may reverse symptoms of CO2 retention. A nurse is caring for a client with a DVT receiving heparin. Which assessment finding indicates a complication? The correct answer is hematuria. This is a sign of bleeding, a serious complication of heparin therapy requiring immediate intervention. A nurse is monitoring a client with a thyroidectomy. Which finding requires immediate attention? The correct answer is tingling around the mouth. This suggests hypocalcemia due to potential parathyroid damage and must be treated urgently. A nurse is caring for a client post-lumbar puncture who reports a headache. The best action is to place the client flat in bed. Post-lumbar puncture headache is relieved by lying flat, which helps reduce cerebrospinal fluid leakage. A client with a head injury has a fixed and dilated right pupil. The priority action is to notify the provider immediately. A fixed and dilated pupil may indicate increased intracranial pressure and brain herniation, which is a medical emergency. A client with a central venous catheter develops dyspnea and chest pain during a dressing change. The nurse should first place the client on the left side and in Trendelenburg position. These are signs of air embolism. This position helps trap air in the right atrium. Thank you for watching. We hope you found these NCLEX-style questions helpful and insightful. Don't forget to subscribe, like, and share this content with your fellow nursing students. Join our community at NCLEX Map for more expert-crafted materials, updated nursing resources, and real-world practice questions. Your success is our passion. Let's conquer NCLEX together.